We're Contingent from Denmark, and it's been a crazy night because we won the Eurovision Song Contest. It's pretty awesome. What we're going to talk about is how keyboards are an infection risk at hospitals. And if you put the next slide up, 15% of infections in hospitals, they happen in the surgical site. And this is a survey from 2009. And one of the infection sources are keyboards and mice because they're really hard to keep clean. So what they usually do is actually at the forensics department in Denmark, they buy 200 keyboards for each case, and to ensure there's no DNA traces traveling between cases, they throw out the keyboard when they start a new case. So there's a lot of spending on new equipment and so forth. Keyboards and mice are great for the dark room where you're not with the patient, but once you get in a point of care situation, the keyboards can be really dangerous or potential disease carriers. This doctor, he works at the forensics department in Copenhagen. We went out to him and investigated his workflow and saw he used computers at his workspace when he was doing autopsies of dead people. And what we found out is that they have to be two doctors. One has to operate the computers, navigating the DICOM scans, the medical imaging, and then the other doctor, the forensics doctor, is telling the other doctor what to do, because when you're doing an autopsy, it's really messy and your hands get bloody, and you can't touch the computer because then it gets all ruined and so forth. And John Zivak, he's an applications manager at an American Children's Hospital, and they want their physicians to be able to navigate pre-surgery imagery while they're doing the surgery, but without having to guide somebody else through the software. They want the physician to directly be able to manipulate the computer. So some have tried to solve this with touch surfaces or smooth surfaces because they're easier to clean. But with recent technology, we believe we can take it even further. The Leap Motion is one of many devices that allow gesture control. So we actually have a touch-free interface where there is no direct contact. And it's very sanitary, and it's very good in that way. So what we have done is we have taken this imagery software, medical imagery software, and we hooked it up to the Leap Motion. And we have a short demo of that. It's called Handle, by the way. Important. So this is running. When I use my whole hand, I'm running through the imagery slices in the scan. And when I use two fingers, I'm running through the contrast levels, so I can adjust this on the fly. And it should be working here as well. It's a bit hard on this angle. So this.
Anyone in the jury wants to comment?
Hi, I think it's a great presentation and a great device. But just a few questions. Can you only use it for scrolling, or can you use it can you use it in any more detailed way?
Yes, well, basically, we haven't familiarized with the Leap Motion or this imagery software before. This is a huge code base. So we did all this in 24 hours. This is
really
very early, but we have endless possibilities of doing gesture recognition. One of the technological difficulties is that it's hard for a computer to determine when a movement is intentional and not. And there will be a lot of like crazy math to figure out when something is intentional and when it's not, because else you have a lot of wrong interpretations from the computer.
I'm very impressed.
Yeah.
Thank you so much.